systems that were considered to be autonomic could be brought under conscious control. And that's the big thing. So when we're seeing post-traumatic stress, everybody pretty much agrees that there's a dysregulation in the autonomic. When we see sleep disorders, something's wrong with the autonomic. When you see digestive disorders, the entire digestive system is under vagal or parasympathetic control, which is part of the autonomic. And so if instead of just doing treatments that would address symptoms, inflammation, pain, mobility, like even in hypertension, there's people know about beta blockers. Well, beta blockers block part of the autonomic nervous system, right? But these are chemical parts to treat symptoms rather than actually creating a strategy that will re-regulate the entire field of feelings and events in there. So we have also been very much over the years, very much in agreement with a lot of things that came out of the mental health field, right? But unfortunately, mental health and say physical pain or mental health and anxiety, the physical parts of anxiety were separated. And so how could two of those be combined together? And now there's a big revolution in mindfulness. Mindfulness meaning the ability to attune our attention inwardly and deal more with the physical sensations rather than just the mental aspects. Because so often in psychotherapy, one learns to sort of manage and harness sort of unwanted emotions or feelings. But now, due to, again, back to neuroscience, people like Damasio are realizing, and so many others, that emotions are not something that are purely in your head. They are bodily states. And I will repeat that. They are physical bodily states. And anything that you can feel, you can re-regulate, you can change. But all of us, and there's very few people I've ever met in dealing with thousands of people that are not afraid of some way and somehow of what they're feeling inside their own bodies. When they're faced with diseases, when they're faced with anxiety, when they're faced with depression, when they're really afraid, and their immediate response is, "Doctor, please take it away." And they're not really they're not really interested in exactly how it got there or what they can do to take it away. But now we're realizing, wow, to really make long-term changes, to really change things forever, one must be brought in there to interact with it.
What does that mean? Like, what do you mean by interact? And what are the points of sensations? Why should I feel these sensations?
Thank you. So, and that's a good question, because a lot of people is like, why do you want me to feel something? Let's take anxiety. So in anxiety, or in panic attacks, people begin to feel a lot of uncomfortable sensations. The heart starts to pound inside their chest. They start to sweat. The palms, there's a tightening in the digestive system. There's tingling and numbness inside the body. And so it gets really scary, because these are the same sensations, of course, that would happen if somebody was facing a real threat. The neighbor's Rottweiler just jumped the fence, and it's coming right at you. And you've got a matter of a few seconds to make a quick move and get back into your car, right? And so if you got in your car and you felt all those sensations that I just said, the pounding in the heart, the tingling, you know where it came from. But now if you're getting the same sensations and you're in the supermarket or you're watching a movie, that's threatening, that's scary. But in fact, it is part of the same system, but because we have become so disconnected, right? And people like Robert Scare make a very important, observation, saying often neocortical, the new brain, the old brain is more what they consider the limbic system, the emotional brain, the fear brain, the survival brain, but the new brain, the thinking brain, the cortical brain, gets inhibited. It says acculturation. Acculturation means the way we've been taught, our culture, our way of life, we've learned to suppress normal functions inside our body. And so when our nervous system, this intelligence, this body tries to do something, we become very frightened by it. And so what happens within panic attack, we're so afraid of what we're feeling that we actually add more fear. It's like adding, more gasoline to the fire. It just explodes. But the new direction is, wait a minute, there's this part of the brain, this wonderful part of our brain called the part of the neocortex called the prefrontal cortex, especially the middle part, right there in the center. And it's like the old part, this would be the fear center, the limbic, and that's the new brain around it. And that's the frontal cortex, and the fear center's in there. But what happens with so much of us, the fear part, the survival part dominates. And so when we try to do things, when we try to change pain in our body, when we try to change anxiety, when we try to change fear, depression, etc., or a lot of unwanted emotions, this part dominates because this is the survival. And we wouldn't probably be here, at least that's the theory, if this wasn't more dominant. But with this arising, it can give us power over this. It can eventually suppress this in a way that we can release all these tensions and energies.
So through the therapy, is that what you're activating or engaging that prefrontal cortex?
So one of the main things in therapy, and a lot of the therapies that we agree with now, whether it's mindfulness and psychotherapy or movement or body work, is trying to make a person interact with sensations and feelings in the body for brief periods. They go in, they go out, because it's very hard for anybody to do that in the beginning without repeated practice and skill, because eventually what's happening, an amazing thing happens, once your brain gets, you know what, this person's not in danger. Jim, it's okay now. Years and years of running from the bear, and the bear, of course, everyone knows the story of the bear. You see the bear in the woods, and you hear fight or flight, but you also can freeze. You freeze because you don't want to be seen, right? But so often in life, we get stuck, they say, somewhere in that, or we get stuck in the freeze response, right? But what if the same bear now, okay, you're out of the woods, but what if that bear comes home from the bar every night? What if that bear comes home for work and that bear is in your house, right? Because that bear is part of the family, right? What's going to happen then? And that repetitive exposure, right? And the repetitive putting one in survival shuts down, we know, the best part of human beingness. And the best part of human beingness, it seems, is the right brain, the sensing, the feeling, the healing brain, right? And it ends up overstimulating parts of the brain that have to do too much with just getting by day to day. And so eventually the pressure builds up in the kettle, and then one day with the slightest sometimes stressor, we're in acute pain on our back, we've got a severe migraine, we're having anxiety, we're having a panic, we're so depressed that we don't understand what's going on with us, right? Because these things have been suppressed for so long.